What do pro football players William the Refrigerator Perry, Mark Schlereth, and actor Andy Griffith have in common? A rare disease called Guillain-Barré syndrome. I had never heard of this disease. So when I started to lose my balance, I had no idea how close I was to losing my life. My name is Denise Medina, and I would like to talk to you about Guillain-Barré syndrome and how it changed my world. WebMD defines Guillain-Barré syndrome as a rare but serious condition in which the immune system mistakenly attacks nerve cells in the body outside of the brain and spinal cord. In early 1994, at the age of 33, I was a recently separated working mom. I worked hard and I played harder. You could say I was burning the candle at both ends. I began experiencing tingling in my hand and in my wrist. My doctor said it was carpal tunnel. He gave me a wrist brace and some anti-inflammatory tablets and told me that everything would be okay. The GBS manifested. It started with weakness in my feet and legs. I began to lose my balance. I even fell to the ground on a couple of occasions. I went to the hospital and they told me it was exhaustion. I just needed to get some rest. The GBS continued to progress over the next 2 days. My next trip to the hospital was in an ambulance. The doctors had no idea what was wrong with me. I was given every test known to man, and still no improvement. My family saw me fading away and knew that if they did not find out what was wrong with me, I was going to die. They had me transferred to the hospital at the University of Pennsylvania, where I was officially diagnosed with Guillain-Barré syndrome and lupus in June of 1994. GBS in its early stages is unpredictable. The last thing I remember is a large machine whirring next to me. My blood was being cleansed by plasma exchange, and I was given high doses of intravenous immune globulins, hoping to shorten the course of my GBS. I went into a coma for a month. I remained in ICU until November of 1994. In December of 1994, I was admitted into a nursing home where I received physical and occupational therapy. I was finally released to go home in April of 1995. I recovered the muscle strength in all of my body except for my ankles and my feet, and I am still confined to a wheelchair. Now, the CDC states anyone can develop GBS, but is more common among adults than children. The incidence of GBS increases with age, and people over age 50 are at greatest risk to developing Guillain-Barré syndrome. Each year, on an average, about 3,000 to 6,000 people in the United States develop GBS. That's 1 to 2 people out of every 100,000 people. According to LifeScript.com, the exact cause of Guillain-Barré syndrome is unknown. However, in about 70% of patients, a recent infection or surgery serves as a trigger to an autoimmune response. History of lymphoma, lupus, or HIV/AIDS also increases the risk of this disease. Most people survive and recover completely. According to the National Institute of Neurological Disorders and Stroke, about 30% of patients still have some weakness after 3 years. Looking back over my experience, I should have taken better care of myself. Hindsight is 20/20. It has been 18 years since I was diagnosed with Guillain-Barré syndrome. Every day I thank God for my life. My lupus has been in remission for 10 years. And I would like to close with a quote by Maya Angelou. Surviving is important, but thriving is elegant. And I'm thriving. Thank you for listening, and I hope you received some information about Guillain-Barré syndrome.